The reason the Gen Vape project came to be is because there was a massive problem following COVID where schools were reporting to us, parents were reporting to us that kids were using these new products that they just didn't understand, and we had virtually no data about what was going on with vaping. It came clear we needed data. We couldn't just rely on anecdotes from teachers or parents anymore, and that's where the Gen Vape project came from. And the data was so helpful and so useful that we brought on national partners, and it quickly spread to be a national project. What the Generation Vape project exposed was that vape access was incredibly easy. There is this massive loophole where non-nicotine vapes weren't covered at all. You can't tell the difference between a nicotine vape or a non-nicotine vape just by looking at them. You have to test them in a lab. So this became an absolute enforcement nightmare. And our research was able to expose this loophole, show how access was so easily, and say, the problem here is you need to close this loophole up. You need to get all vapes out of retailers. It's one of those things that started out small and then gained momentum and is now a national survey of teenagers, young adults, their parents, and teachers all across Australia. And we survey them every 6 months. Often, when you're doing research, it can be decades or years before there's any policy impact. And to see that the government has responded by restricting access to vapes to pharmacies only, that we're no longer going to see these pink, raspberry, unicorn, sparkly, disposable vapes sold absolutely everywhere to children, it's just so gratifying, and it's so nice to see the Gen Vape team recognized for all that hard work. I really have to tip my hat to the Cancer Council New South Wales, who's kind of the brains trust behind this and understands that you need to work with government partners, both at the federal level, the state level, research institutions like University of Sydney, where I'm based, and the Daffodil Centre, and philanthropic partners like the Minderoo Foundation. And I think one of the really unique aspects of the Gen Vape project is how from the very get-go, we wanted to communicate our research through the media and to the public. We didn't want to just publish papers in journals that were read by a few other academics. And we worked with youth-based media like Pedestrian and the Daily Oz and made sure that that 18 to 24-year-old audience was also getting correct information. There are so many people to thank as part of this project. It truly is a partnership. I'm the chief investigator from the University of Sydney. And then we also have partners from the Cancer Council New South Wales, the Cancer Institute New South Wales Health, the federal government's health department, and our philanthropic partner Minderoo.